a question? Do you have a question, sir? Okay, I'm just telling you, all those points I take, I'm going to have to go because the CME Klobuchar.
Everybody turning? Good morning, and thank you all for coming out today. I'm David Mitchell. I'm a cancer patient, and I'm founder of Patients for Affordable Drugs Now. We're here to advance historic legislation to lower the prices of prescription drugs and change the trajectory of drug price policy in America. Bottom line, we aim to make our system work better for the people it is intended to serve, rather than the people who profit from it. Here today, and in the work we're about to do in the coming month, we represent patients, consumers, older Americans, workers' unions, large and small employers, doctors, and other health professionals, all of whom are joining together to help Congress get the job done. We're kicking off the push for lower drug prices, calling on the Senate to advance the comprehensive set of reforms that have already passed the House, and to make major progress on the legislation by Memorial Day. Our campaign will mobilize all the collective resources at our command, including outreach from constituents to their senators through letters, calls, and meetings, paid advertising like the full-page ad that you see here, social media organizing, and much, much more. Today, we released the results of a new national survey demonstrating yet again that this issue enjoys overwhelming bipartisan support. The American people want comprehensive drug price reform. The issue is personal. Almost 50% of respondents say they or an immediate family member have been hurt by high drug prices. 77% say they know pharma can live with slightly lower prices, which is all we're calling for, and still provide the true innovation we want. 83% want Medicare to negotiate on their behalf. 4 out of 5 want to limit annual price increases by the drug companies. We stand together today with determination to get it done. We are very honored today to have with us 2 leaders in the fight, Senator Amy Klobuchar of Minnesota and Senator Catherine Cortez Masto of Nevada. Both have been stalwarts, standing up for patients and all Americans. To kick us off, Senator Cortez Masto.
Thank you. Thank you, everyone. Thank you so much for joining us today to talk about bringing down the cost of prescription drugs, not just for Nevadans, but for everyone across the country. I know many Nevadans come face to face with this problem every time they're at the pharmacy, including our seniors. I just came from Nevada during this recess, had a roundtable discussion with Nevadans about this very issue. And it is the heart of what I see and hear from so many in my state, addressing not only the high cost, but the access to the drugs when they need them. And that's what this is about. This is one of the top concerns. So no one should have to ration life-saving medication or choose between paying for food and affording medicine. I have been working along with my colleagues, and Amy Klobuchar has been lead on this issue for so long, but we have to make progress on the issue of prescription drug negotiation. It is time. We need to give Medicare more power to negotiate for better rates for patients. The Secretary of Health and Human Services needs the tools that will let him get fair prices from pharmaceutical companies. And yes, we can do this without limiting patients' access to safe, effective drugs. I don't support that, and that's not going to happen. I have worked, as I sit on Senate Finance, to cap out-of-pocket expenses for drugs for seniors. And I push for penalties that would keep drug companies from increasing prices faster than the rate of inflation. So yes, not only am I going to continue, I know Amy is, but so many of our colleagues will continue to do everything we can to bring down these drug costs, not just for Nevadans, but for everyone across the country. This includes a bill to cap patients' out-of-pocket costs for insulin at $35 per month. More than 1 in 4 seniors in Clark County has diabetes, and no one should have to ration that medication for any reason whatsoever. So let's be clear, these policies will let drug companies continue to innovate without gouging patients or federal taxpayers. Drug companies, and I see this in commercials in my state, claim that without sky-high prices, they'd be unable to bring new drugs to market. Yet they spend billions every year on marketing and advertising, and still they continue to rake in tremendous profits. It is time to push back on the idea that things have to be this way. They do not. So I will be working in the Senate on this issue because the health of Nevadans is my top priority. Thank you so much for joining us here today. Thank you to the groups for continuing to bring attention to this important issue and policy that we need to finally pass in this country. Thank you.
Thank you, Senator Cortez Masto. She has to hurry to a hearing. I am very proud to introduce Senator Klobuchar of Minnesota.
All right, thank you. Well, thank you so much, David. Thank you, everyone. This is a lot warmer than Minnesota, I've got to say. I'm happy to be back, and I'm especially honored to be with my friend Catherine Cortez Masto, former Attorney General of Nevada, has an understanding of what this really means to people in their everyday lives. I also want to thank Joanne Jenkins, who's been tireless. Maybe some of you have seen her on TV ads. She has not given up, and AARP, such a powerful organization, stands with us. We're here to say this is it. This is game day. And I'm not just saying that because the Timberwolves are playing tonight. I'm saying that for those of you that aren't watching the NBA playoffs. We're proud of our team. But I'm saying this because this is it. The next 2 months, we've got to get this done. And we were so close a few months ago. And so I'm not going to be able to stay the entire time, but for those of you who are in the nitty-gritty of what's happening with the Senate procedures, yes, this is on the table big time. And as you know, we were very close to an agreement on the provisions between the House and the Senate for negotiations. So while we are undergoing bipartisan negotiations on the insulin issue and the insulin cap, right now, and this is why Catherine and I are out here today on this beautiful spring day, we are working to get done the Medicare negotiation. Why? The results are clear. Prescription drug prices in the U.S. are more than 250% of those in other industrialized nations. We have the highest costs and prices for drugs in the world. In the past 5 years, the cost of Lyrica, that's nerve pain drug, you know what it is, and Symbicort, a common asthma medication, those have increased almost 50%. The results are dire. Nearly 40% of patients did not take their drugs as prescribed due to high costs, and 20% of patients took on debt to pay their medications. Why? Well, years ago, Big Pharma got a provision written into law. Let me make that clear. This isn't some court case. It's written into law that Medicare cannot negotiate less expensive drug prices for the seniors of this country, for Medicare. They're banned. It's a ban for negotiations. While the VA can negotiate and gets much better prices, and we're so happy they do that for the veterans, not for the over 40 million seniors in the United States of America. Why? Well, Big Pharma thinks they own Washington, but they don't own me. And they don't own Joanne Jenkins. And they don't own AARP. And they don't own you. And this is the moment to make it clear. I am glad that we have been engaged in negotiations with our colleagues. I am disappointed that my Republican colleagues, more than disappointed, aren't joining us on this very straightforward, pro-consumer, pro-people provision. But yet, we were so close to getting it done just a few months ago in that archaic process called reconciliation that, no, I'm not going to go into right now. And we are close to doing it again. We must get this done. I don't know how else you tell people like Claire from St. Paul the cost of the prescription drug she relied on to manage her rheumatoid arthritis jumped from $60 per month to $1,400 per month. After trying unsuccessful alternative medications, Claire began trying to self-medicate with the over-the-counter options. As a result, her arthritis got so bad that she couldn't even hold a fork. Or the other people I've met, seniors in Minnesota, that literally take their insulin and they save it, the little drops of it from day to day to day. A common drug that used to just cost a couple bucks. but in the hands of pharmaceutical companies that are trying to make a whole bunch of money on the backs of the seniors of this country, it skyrocketed up. Again, the solutions: pass my bill and make some version of it part of reconciliation to unleash the power of 46 million seniors so they can negotiate for better prices. Number two, end the outrageous and unpredictable medication price hikes. Number three, limit the out-of-pocket costs for Medicare Part D beneficiaries. And number four, cap the insulin copays at $35 per month, a bill that my friend Senator Warnock has introduced and something that is currently in negotiations with the Republicans. That's how you stand up to the lobbyists in every corner of that building. There are literally more than 2 lobbyists per member of Congress when it comes to pharmaceuticals. It is time to take this on and do something for the people of America. Running ads on it, talking about it all the time, okay, fine. But at some point, you have to get it done, and I call on my colleagues to do that. Thank you very much.
Thank you, Senator Klobuchar. The impact of high drug prices is heard in the stories of patients from coast to coast, millions. Meg Jackson-Drage is a Medicare beneficiary who traveled from Utah to share her story with you this morning. Meg?
Thank you. Hello, my name is Meg Jackson-Drage and I'm here from Salt Lake City, Utah. To start, I am an AARP member and I want to thank them for the fighting so hard to lower drug prices for people like me. I live with fibromyalgia and neuropathy for pain for many years. Both of these conditions leave me with chronic pain, limited mobility, and expensive medications. After trying several medications that were not effective to manage my condition, I saw a glimmer of hope when I was prescribed Lyrica. For the first time, it alleviated much of the pain that I dealt with every day, but quickly that hope faded. Lyrica is priced at over $850 per bottle. I need somewhere between 1 and 2 bottles a month, and I cannot afford that. So I made a very tough decision to go without, forcing me to live in pain, take less than ideal medications, go on disability, and retire early. When Lyrica first came to the market in 2007, the same dose was priced at $150. Since then, the price has gone up by more than the rate of inflation every year, pushing it farther and farther out of reach for patients like me. We shouldn't have to live in this reality. That is why I flew all the way from Salt Lake City this week to be here and beg the Senate to finally deliver on its promise to bring relief to me and millions of Americans. We need the Senate to act on a comprehensive plan right now, including Medicare negotiations and capping the cost for Medicare beneficiaries like me. Patients have waited too long. Congress, we are counting on you. Thank you.
Meg, thank you very much for making the trip and for those remarks. Frankly, we wouldn't be here today, we wouldn't be where we are, so close to potentially passing real reform that can help people like Meg and millions of other Medicare beneficiaries were it not for the leadership and determination of AARP. I am very pleased to introduce the CEO of AARP, Joanne Jenkins.
Good morning, everyone, and thank you to Senators Klobuchar and Senators Cortez Masto, Patients for the Affordable Drugs Now, and the other groups and patients here today for the opportunity to speak to you about the urgent need for Congress to deliver on the promise to lower drug prices. I stand here on behalf of AARP's nearly 38 million members and the over 4 million Americans who signed our petitions calling for lower drug prices, with one message: the time to pass Medicare drug negotiations and the hard-fought compromise on prescription drug pricing is now. Every day, AARP hears from older Americans who are forced to choose between paying for medicines they need and paying for food and utilities. That's just plain wrong. It's outrageous that Americans pay 3 times more than people in other countries for the exact same drugs. There is no mistaking why there is such overwhelming support for the policies before the Senate today. For years, prescription drug prices increases have dwarfed even the highest rate of general inflation. If consumer prices had risen as fast as drug prices over the last 15 years, gas would now cost $12.20 and a gallon of milk would cost $13. And that's why, as Congress works to fight inflation, lowering drug prices is the most important and long overdue policy. There is long-standing bipartisan support among voters for the proposals currently on the table, including finally allowing Medicare to negotiate the drug companies for lower prices. Giving Medicare the power to negotiate will save seniors millions of dollars and taxpayers billions of dollars overall. American families cannot afford to lose that kind of money due to high drug prices. AARP is fully committed to this fight, and we won't stop until we get the relief that we need for older Americans and all Americans. Today, we are calling on Congress to make this a priority for action now, and it's time for all of us to insist that this gets done. Thank you.
Thank you, Joanne. Employers, big and small, are struggling to pay for drugs in the U.S. that, as you heard, cost multiples of what they cost in other countries. The Purchaser Business Group on Health is a coalition representing the healthcare interests of nearly 40 of the nation's largest corporations. Its members collectively spend over $350 billion annually on healthcare on behalf of more than 20 million Americans. And it has been making the case for reform of drug pricing in this country before Congress. We are very pleased to have with us today the Executive Director for Health Policy, Bill Kramer.
Thank you, David, and good morning. I'm exceptionally pleased to be here with this coalition of labor, consumer, and business organizations, along with patient advocates. And special thanks to Senators Cortez Masto and to Senator Klobuchar for their leadership in advancing this legislation in the Senate. Most of the media attention on this bill has focused on Medicare prices, rightfully so. But I'm here to talk about the 180 million people who have private health insurance coverage through their employers. This is working families and other people who get coverage through private insurance. These people face high drug prices too. And in fact, the age group that has the most vulnerability to high drug prices are those under 65, based on a recent Gallup poll. Therefore, it's essential that the legislation to limit drug price increases applies to all Americans, including those 180 million people, those working families, because they are vulnerable to those price increases as well. And if the legislation does not include them, they will be left behind. And it will leave them vulnerable to further price increases without check. So the bottom line is, we call on Congress to pass this legislation and ensure that all Americans are protected from high drug prices. Thank you.
Thank you, Bill. Doctors are on the front lines of the fight to keep people healthy in the face of treatments that are too often out of reach for some patients. Dr. Rita Kurihara joins us today to offer a physician perspective. Dr. Kurihara is a primary care internal medicine physician and a national leader in Doctors for America, working to make medicines affordable for all. Doctor?
physician, I have a primary responsibility to care for my patients, and I find it unacceptable that in a nation as wealthy as ours, 1 in 4 people have difficulty paying for their prescriptions, and we allow people to die because they cannot afford their medicines. I stand here today to give voice to my patients. When my patients with diabetes start crying in the exam room because they cannot afford their insulin, I cannot, in good conscience, look into their eyes and say, "I'm sorry you were forced to choose between buying your life-saving insulin and putting food on the table for your family." Sympathy and empathy are not enough, and this is not a partisan issue. We need action, and we need it now. Our patients and communities cannot wait. These are not theoretical conversations, and our decision to act or not act can be the difference between life or death. It is critical to immediately pass comprehensive drug pricing reform, including capping out-of-pocket costs for insulin at $35 per month and allowing Medicare to negotiate prescription drug prices. Congress must act now to make medicines affordable for all, regardless of personal finances or health insurance status, so that we may end existing inequities and improve the health of everyone in our nation. Thank you.
Thank you very much, Doctor. The pain of high drug prices is felt acutely by people with chronic diseases like multiple sclerosis. And the National Multiple Sclerosis Society has helped lead the fight for lower prices. I am very pleased to introduce Barry Talenti, the Executive Vice President of Advocacy and Healthcare Access at the National MS Society.
Every day, Congress delays. People with MS make the difficult decision to stop taking their medication due to the cost. These are real people who risk disease progression from which they may not recover, like Judy in Phoenix, Arizona. Judy's on Medicare and is unable to afford the more than $7,000 out-of-pocket cost each year for her MS disease-modifying treatment. So she made the heartbreaking decision to stop taking her DMT. And every day, she hopes she won't have a relapse or see signs of disease progression. A $2,000 out-of-pocket cap and smoothing mechanism would help Judy and many others like her be able to take their medications again. But redesigning Medicare Part D isn't enough. 6 of the MS disease-modifying treatments have increased in price more than 200% since they came on the market. That's not innovation, and we have to be able to talk about that. Out-of-pocket caps, inflationary rebates, and Medicare negotiation are all needed to protect people who rely on life-changing medications.
Thank you, Barry. Unions confront high drug prices as they work to ensure high-quality health care for their members. Joining us this morning is Valerie Long, the International Executive Vice President for the Service Employees International Union.
Thank you, David. I stand at CVS's or Giants, and in front of me are folks, some of which are members of our union, some of which are just struggling, making choices about, can I get half this prescription? Can I get half this pill? These are life-changing choices that no one should have to make. And we stand together, this August coalition of healthcare providers, electeds, retiree groups, to say, let's pass this legislation. It is unfair that we give these choices. We force workers, citizenry into these choices, that they have to make a choice between medicine and keeping the lights on, quite frankly. We have to make a choice about what we value in this country and how we care about the least of these. And I believe, and I'm sure all of the folks behind me believe, that we can do better and that we need to focus on what's most important and need to make sure that we are saying to ourselves that we've done everything that we can for workers in this country, for the sick people in this country that need these drugs and shouldn't go bankrupt to get them. The communities deserve this, our workers deserve this, and I know that we have it within ourselves to make this happen. Thank you very much.
Thank you, Valerie. And last but not least, and to bring us back to the reason we are all here today, patient advocate Jacqueline Garibay has traveled all the way from Austin, Texas to share her story.
My name is Jacqueline Garibay, and I'm a 20-year-old college student from Austin, Texas. 2 years ago, I was diagnosed with ankylosing spondylitis, an autoimmune disorder that affects my spine and most of my major joints. To treat my AS, I need an expensive biologic, Taltz, to prevent my spine and hips from fusing, which would leave me unable to walk by graduation. But just 1 month of this medicine is priced at $6,272 and comes with a cost of $3,850 per month for me, even with insurance. How can anyone afford that? My aunt has the same condition, and she has lost her ability to walk because she couldn't afford her drugs, and I'm terrified that the same could happen to me. I live in constant worry about how I will be able to afford my high-priced medications, rent, tuition, and groceries all at the same time. Last time I went to fill my prescription, I decided to forego it because it was too expensive. After graduation, I want to go to law school, but my dreams and independence are threatened by having to constantly worry about being able to afford my treatment. I'm supposed to be studying at the George Washington University, but haven't been able to attend college for the past year because of my pain. I shouldn't have to choose between furthering my education and my mobility. I want the Senate to understand that passing comprehensive drug pricing reform will give me and millions of others peace of mind and the ability to pursue our dreams without worrying about whether the price of our drugs will stand in the way. The Senate must advance the drug pricing reforms passed by the House, including capping price increases at inflation for drugs like mine. The future and health of patients like me depend on it. Thank you.
Thank you, Jacqueline, and thank you to all of our speakers today. The groups represented here are united and energized to push for lower drug prices in the coming weeks and to get something done on comprehensive drug pricing reform by Memorial Day. With that, we'll take any questions you may have from the news media. If we were all crystal clear and there are no questions, then thank you very much for being here today. We're finished.